All right, students. Today I'm going to do a quick video on putting your lab shifts into FISDAP. Okay, this is a requirement for all students here at Atlanta Technical College, and I'm looking at some of the results that we have on FISDAP, and it seems to be that some people either aren't doing it or maybe they don't understand how. So I'm going to do a quick video here to show you what you're missing. Okay. So as you pull up your FISDAP and stuff here, it'll show your your name and all your lab shifts and clinical shifts. Okay. Clinical shifts will either be in blue or green, depending on where you go, and your yellowish orange ones here are all lab shifts. Okay. So if you go in here, like I said, today we're just going to talk about lab shifts real quick. If you go in here to a lab shift, um, one of the ones that are open, it'll take just a minute for it to warm up here. Oh, sorry. So that was on one that is scheduled but hasn't been done yet. So we'll go to one that has been done. All right. And if you look, the first thing that pops up here is this spiel here. Okay. If you're an EMT student, it should show ATC standard EMT simulation lab goals. If you're an AEMT student, it would say AEMT, and these are the goals that were set in 2020. So these are the current goals. Okay. As you go through here, and you can click on this left-hand corner, hit expand all. This shows you the things that need to be done. Okay, so if you look here in your lab shifts, you should have a PCR that has adolescent, PCR that is for school age, PCR for infant, a PCR in toddler, and a PCR in newborn. Okay, in airway management, you'll see here that it says ET tube success. We haven't figured out how to get rid of that because EMTs and AEMTs don't do ET tubes, but you should have on there for AEMTs and EMTs both, you should have some VVM ventilations in airway management, and that'll bring this goal up. Okay. For certain complaints, you should have a chest pain complaint, an altered mental status complaint, an abdominal pain complaint, and an adult dyspnea. Okay, and here it shows how many that you need. Okay, again, these are PCRs that you would do in lab skills, not skills. Okay. Um, Also in the PCRs, under your impressions, along with chest pain, altered mental status, abdominal pain, and dyspnea, you have trauma, abdominal pain, psychiatric, cardiac arrest, respiratory compromise, just cardiac related, which could be, like your chest pain from up here, that kind of thing. An obstetrics call, a neuro, and a medical call. Okay. Now some of these, like your chest pain here, okay, if you have cardiac arrest and a cardiac here, okay, that will take care of the two chest pains up here. Okay. So it's very important that you look at your different scenarios, and if you document correctly, some of these are double. Like if you have a trauma and the patient hit their head, has altered mental status, that would take care of one of each of these. Okay. Here in your skills, it says ventilations with your BVM. Also says medications in your scope of practice. Okay, so in EMTs, that's your, meter dose inhaler, patient's nitro, that kind of thing. For AEMTs, that would be all the EMT drugs plus the new ones in your scope of practice. Okay, and then team leads. You should have team leads, especially in the lab. Uh, and you would put that when you did the lab, you were a team lead. That would give you this here. Okay, so these are all mandatory. If all these bars aren't green, then you're not going to graduate. Just makes sense. All right. Now, as far as the skills portion of it, um, all these skills that you do, the National Registry skills and stuff that we do for checkoffs, those should all also be in here. You should have at least 5 peer-to-peer checkoffs and an instructor checkoff for every skill. Now, some of those, there's a couple more added. Some of them, the minimum is 5 and 1. Okay? So to add a skill, like a National Registry checkoff skill, you can simply go down here to the lab practice items, and if we were to click BVM ventilation, which everybody has to do, click that on, hit go under your shift, and here you'll see an evaluator and the person who's doing the checkoff, okay, which should be your name. If you're going to do your peer-to-peers, you need to change this from instructor to student, okay? And then you can pick the student's name. Let's see if I can pick one in here. Who's your classmate? It's in alphabetical order. So I can go in here and pick another student. Okay. Put in the date that I do this. Okay. And do it just like a checkoff. Okay. So if Mr. Ricky was doing this evaluation on bag valve mask and Miss Gamble was doing the evaluating, okay, just like having a National Registry check sheet in front of you, you go through and put in this, okay? There's critical criteria at the bottom. When you're doing your peer-to-peers, you shouldn't have all first-time pass rates, okay? It's okay, especially in the beginning of your program, to have a failure, okay? So you check the person off. If they don't do it right, then put that they didn't do it right, okay? And they need to go back and practice and do it again, okay? So you should have 5 successful peer-to-peer checkoffs, and however many unsuccessful you have, that's fine. It doesn't count against you, okay? In fact, it shows improvement, okay? So you can go in here and click these in. If they did this right, they checked the responsiveness, they checked breathing, you gave them your little scenario, they did all of this, put it in, okay? And say they didn't suction, okay? They forgot to suction at all. They did something else instead, okay? And put patient in recovery position instead of suction, okay? And I'll set that up in there. Evidently I've got my caps lock on, okay? And so they missed the suctioning, and then they went back in here and they did this after the airway was clear. They did the ventilation and everything right. Say they didn't check for chest rise and fall, but they did do it at the proper rate, so we give them 1 point there. So we go and they didn't suction. And I don't see, oh, there we go, failure to suction patient. So I click that. Since they put them in the recovery position for a little bit, they didn't operate as a competent EMT. I click that. We put the time in, and then we come down here, and we put that it was 10/21 that they did that. Okay, and you'll see down here that it says failed. Okay, and we could hit submit and close. Okay, so that goes back in here. It shows here that they had a peer-to-peer BVM ventilation, and they failed it on the mannequin, and then we would go back and do it again. So if you look here, this will not show as successful, which is fine. Okay, and then if we were to go in and do it again and be successful, it would show up in here. Okay, so you need to do that for every skill. If you look, oxygen administration is in here, bleeding, wounds, and shock, long bone, all of that is in here as a skill. Okay, when you go in to do a patient, say you're given a scenario, and so you have to do a PCR. So you go in here and you would add a patient. Okay, and here you can put your PCR. Okay, again, especially for the new EMT students, I recommend using the soappcr.com, filling in all the blanks there, and then you can copy and paste your narrative in here. Okay, make sure you click all of the make sure you click on all of the buttons here. If you're the team leader, then click out that you are the team leader. Okay. Make sure you perform the patient interview, you perform the patient exam. If the patient required airway management, here's AVPU, age, gender. Here's the complaints we were talking about earlier. So you have this list of complaints, okay? And then we have impressions, okay? So if we had, let's see, chest pain, okay? And then over here on the primary, we could say it was cardiac other. Okay, maybe they're having angina, something like that. And then over here in your secondary impression, we could say that they had respiratory problems too. They're having difficulty breathing, right? So you click all this in, vitals. Every patient, regardless of whether it's the lab or on your clinicals, should have at least 2 sets of vitals. Anything less than 2 sets of vitals, the PCR does not count. Okay? If you do airway, you can click on whatever treatment you did here, whether it was a LMA, an NPA, whether you did manual ventilation, whatever that is. If you did suction, it's also under airway and stuff here. So that's where that would go. Under cardiac, of course, EMTs and AEMTs can't read EKG or can't interpret an EKG. So you shouldn't put anything here unless your proctor tells you, hey, it's normal sinus rhythm. And you still wouldn't click, I interpreted this rhythm. No EMT or AEMT should click that they interpreted this rhythm. Okay? However, you can do the procedure. if you did chest compressions, that kind of thing. Okay, that's where that goes. Venous access, EMTs, you don't have to worry about that. But if your paramedic or something puts in, or your AEMT puts in a line, again, make sure you click that you didn't perform it. Don't do anything outside of your scope of practice, and then you can fill in the blanks here. Okay, medications, all your medications that you do. If you're an EMT and you help them with their, if you give them aspirin, okay, then you could click this in here. You got to put the dose in. Okay, make sure you put it in right. It's milligrams, milliliters, whatever it is, and how it was given to them. Okay, all of this has to be completed. Okay, and then there's some other procedures and stuff here. If you have to pulse ox, everybody should have pulse ox if that's not under vitals. Restraint, scoop stretcher. When would you use a scoop stretcher? You should know that. Tourniquet, wound care, that kind of thing. You can look for that under other. Patient disposition, transport mode from the scene. All this has to be in here, okay? And then your narrative. The more you fill in on the front, the more you get here. But then make sure you put in your SOAP format. And if you have any problems, talk to your instructor or the clinical coordinator. Okay? So, that should be just about everything you need for putting in your stuff here. See, I clicked a few things in here. And notice how the numbers change. Okay, so I'm gonna go back in here and delete this stuff, and then the numbers will change back to nothing here in just a second. Okay, all right. So we're gonna go back to the shift here. Boom, boom, boom. Alright, and anybody, if you need a shift unlocked or something, you have to get with your instructor or the clinical coordinator if it's been over 48 or 72 hours, depending on what kind of shift it is. Okay? It would behoove you, which means it would be to your benefit, to make sure this is where you upload your documents. If say you didn't have a computer or whatever handy and you were doing your skills checkoffs or something, or peer-to-peer with the national registry sheets, you could upload them here if you wanted to. It's just so that you can prove that you did it. Okay, because if it's not uploaded here or you didn't get it in your file, then you can't prove that you did it. Okay, so this is where you upload things. Same with your clinical rides. If you're an EMT, medications, AEMT, if there's medications, whatever it is, all this stuff needs to be uploaded back in here. Okay, so if you have a medication sheet, the sheets that your proctor signs, that kind of thing, all get uploaded with this little clip right here. Okay, so you can go into your shift. Even though this hadn't started yet, excuse me, you would go and do all your shift stuff. When you get done, within 48 to 72 hours, you can lock your shift. This lets your clinical coordinator and your instructor know that you're finished with it, okay, and they can look at it and check it, okay. Like I said, this isn't that hard to do. It's just a matter of making sure you fill in all the blocks and stuff. So if you have any questions, contact your instructor or the clinical coordinator.